TAVR treatment is a very safe and effective treatment for patients of aortic valve disease, mainly aortic stenosis where the valve becomes very narrow, or sometimes there is a leakage of the valve which is aortic leakage. In these cases, the first test to diagnose the problem is an echocardiography test. An echocardiography test is fairly accurate in deciding which patient should go for a valve replacement like TAVR procedure or not. And if the echo shows that the gradients and everything is okay, we can follow these patients on medicines till the time comes where the gradient or the pressure becomes too high inside the heart. And then how do we decide whether we need to do a TAVI, and how will we do the TAVI, what size of the valve has to be used? For that, a very important test today which we do is known as the CT aortography test. The CT aortography test is again done without admitting the patient. It takes about 15 minutes to do the test, and thereafter we can exactly measure the size of the valve which can be used, how we do it, all the procedural details can be mapped out after assessing or analyzing the CT scan report. So which means that it has become very predictable, very accurate from the very beginning, that how the procedure will go, what are the complications which we can expect, and how to mitigate those complications. So which means the procedure becomes very safe if we do a good CT angiography, CT aortogram, and analyze it, and then make a perfect decision about the selection of the valve, which valve we are going to use for which patient. So this is the beauty of these two tests, the echocardiography and the CT aortography, by which we can decide when and how to replace the valve without having any serious complications. Then about the size of the valve is also very easy now to assess beforehand. So we know, because earlier in surgery, once the chest is open, then only you can know which size of the valve to be used. But now when we do TAVR, with the help of these tests, we know exactly which size of the valve is going to be used, so that there is no problem in taking those decisions at that time. Now, the advanced imaging techniques are really making this procedure very safe, very predictable, and with good short-term and long-term outcomes.